Understanding frontotemporal dementia. Causes, symptoms, and treatment options. Frontotemporal dementia (FTD) is a form of dementia that primarily affects the frontal and temporal lobes of the brain. This type of dementia is less common than Alzheimer's disease, but it still affects a significant number of people. FTD can be difficult to diagnose and treat, as it often presents with symptoms that are different from those of other types of dementia. The symptoms of FTD can vary greatly from person to person, but they generally include changes in personality, behavior, and language. In this blog post, we will explore the causes, symptoms, and treatment options for FTD to help you better understand this condition and how to manage it. With a better understanding of FTD, you can provide better support and care for loved ones who are affected by this condition. 1. Introduction to frontotemporal dementia (FTD). Frontotemporal dementia (FTD) is a progressive neurological disorder that affects the frontal and temporal lobes of the brain. These areas of the brain are responsible for behavior, language, and executive functions such as decision-making, planning, and problem-solving. FTD is a group of disorders that are characterized by changes in behavior, personality, and language. FTD usually affects people between the ages of 45 and 65, although it can occur in people as young as 20 and as old as 80. The onset of symptoms is gradual, and the disease progresses over several years. Early symptoms of FTD are often mistaken for depression or a midlife crisis, and it can take several years before a correct diagnosis is made. There are two main types of FTD: behavioral variant FTD (BVFTD) and primary progressive aphasia (PPA). BVFTD is characterized by changes in behavior, personality, and social skills. People with BVFTD may become socially inappropriate, lose empathy for others, and display impulsive or compulsive behavior. PPA, on the other hand, affects language skills, making it difficult for people to express themselves or understand language. Currently, there is no cure for FTD, and treatment options are limited. However, there are medications that can help manage some of the symptoms of FTD, such as depression, anxiety, and agitation. In addition, there are therapies that can help people with FTD maintain their independence and quality of life for as long as possible. 2. Causes of frontotemporal dementia. Frontotemporal dementia (FTD) is a complex neurological condition that is caused by the degeneration of the frontal and temporal lobes of the brain. The exact causes of FTD are still not well understood, but researchers believe that a combination of genetic and environmental factors may play a role in its development. In some cases, FTD is caused by genetic mutations that are inherited from a parent. Researchers have identified several genes that are associated with FTD, including the MAPT, GRN, and C9orf72 genes. However, not everyone who carries these genetic mutations will develop FTD, and in many cases, the condition occurs spontaneously. Environmental factors may also contribute to the development of FTD. For example, head injuries, infections, and exposure to toxins may increase the risk of developing the condition. There is also some evidence to suggest that lifestyle factors, such as diet and exercise, may play a role in the development of FTD. It's important to note that FTD is a rare condition, and most people who experience changes in behavior and personality as they age do not have FTD. However, if you or a loved one is experiencing symptoms of FTD, it's important to speak with a healthcare professional to get an accurate diagnosis and develop a treatment plan. 3. Types of frontotemporal dementia. Frontotemporal dementia, or FTD for short, is actually an umbrella term for several different types of dementia. The most common types of FTD are behavioral variant frontotemporal dementia (BVFTD), semantic variant primary progressive aphasia (SVPPA), and nonfluent agrammatic variant primary progressive aphasia (NFVPPA). Each of these types of FTD affects different areas of the brain and can have distinct symptoms. For example, BVFTD often involves changes in behavior, personality, and social interaction, while SVPPA typically affects language and comprehension. NFVPPA may also affect language but often involves difficulty with speech production. It's important to note that the symptoms of FTD can overlap and there can be variations within each type. Additionally, there are other rarer types of FTD, such as progressive supranuclear palsy (PSP) and corticobasal degeneration (CBD), which have their own unique symptoms and characteristics. Overall, understanding the different types of FTD and their respective symptoms can help with early diagnosis and treatment. If you or a loved one are experiencing any concerning symptoms, it's important to consult with a medical professional for proper evaluation and care. 4. Symptoms of frontotemporal dementia. Frontotemporal dementia (FTD) is a neurodegenerative disorder that affects the frontal and temporal lobes of the brain, which are responsible for decision-making, social behavior, and language skills. The symptoms of FTD often depend on the specific area of the brain that is affected, and may differ from person to person. One of the most common and earliest signs of FTD is a change in behavior and personality. Patients may become impulsive, apathetic, or exhibit inappropriate social behavior. They may also experience a lack of empathy, and display a decreased interest in personal hygiene and grooming. Another common symptom of FTD is language impairment. Patients may struggle with finding the right words, have difficulty understanding language, and may struggle with reading and writing. Some patients may even develop a language disorder called primary progressive aphasia (PPA). As the disease progresses, patients may also experience movement disorders, such as muscle weakness or stiffness. This can lead to difficulty with walking, coordination, and balance. They may also develop muscle twitches, spasms, and tremors. Other symptoms of FTD may include difficulty with problem solving, decision making, and planning. Patients may also experience memory loss, which can be mistaken for symptoms of Alzheimer's disease. In some cases, FTD may also cause a decline in visual perception and spatial awareness. It's important to keep in mind that the symptoms of FTD can vary widely from person to person, and can also be confused with other conditions or diseases. If you or a loved one are experiencing any of these symptoms, it's important to seek medical attention from a healthcare provider with experience in diagnosing and treating FTD. 5. Diagnosis of frontotemporal dementia. Diagnosing frontotemporal dementia (FTD) can be challenging as it often presents differently than other types of dementia. Doctors will typically start with a physical exam and medical history to rule out other conditions that may be causing symptoms. They may also conduct a neurological exam to check for any issues with movement, coordination, or reflexes. Another tool used in diagnosing FTD is neuropsychological testing. This involves a series of tests that evaluate cognitive and behavioral abilities such as memory, language, attention, and decision-making. The results of these tests can help doctors identify specific areas of the brain that may be affected by FTD. Brain imaging tests such as MRI or CT scans may also be used to identify any physical brain abnormalities that may be causing symptoms. In some cases, a PET scan may also be used to detect changes in brain function. It's important to note that FTD can be difficult to diagnose as its symptoms can mimic other conditions such as depression, Parkinson's disease, or Alzheimer's disease. As a result, it can take some time and multiple tests to arrive at a proper diagnosis. If you or a loved one are experiencing symptoms of FTD, it's important to speak with a doctor as soon as possible to get an accurate diagnosis and appropriate treatment. Early intervention can help slow the progression of the disease and improve quality of life. 6. Treatment options for frontotemporal dementia. Frontotemporal dementia (FTD) is a complex disease that can affect people in different ways. There is no cure for FTD, but there are some treatment options that can help manage the symptoms and improve the quality of life for those affected. One of the most common treatment options for FTD is medication. Medications such as antidepressants and antipsychotics can help manage the behavioral and psychological symptoms of the disease. However, it is important to note that these medications can have side effects and should only be prescribed by a doctor who specializes in the treatment of neurodegenerative diseases. Another treatment option for FTD is therapy. Speech therapy can help improve communication skills which can be lost during the disease's progression. Occupational therapy can help those affected maintain their independence and learn new skills. Physical therapy can help with mobility and maintaining muscle strength. Finally, caregivers play an important role in the treatment of those with FTD. Caregivers can provide emotional support and help manage daily activities such as bathing, dressing, and eating. Joining a support group can also be beneficial for both the patient and caregiver, providing a safe space to share experiences and learn from others. It is important to note that the effectiveness of these treatments will vary from person to person and there is no one-size-fits-all approach to treating FTD. A care plan should be developed in collaboration with a healthcare professional who specializes in the treatment of neurodegenerative diseases. 7. Support for those with frontotemporal dementia and their families. Frontotemporal dementia (FTD) can be a challenging diagnosis for both the person with the disease and their family members. However, there are different types of support available to help manage the disease and improve the quality of life for those living with it. One of the most important types of support is social and emotional support. It is essential for families to have a strong support network that can provide comfort, advice, and assistance when needed. This can come from friends, family members, or support groups. Support groups offer a valuable opportunity for individuals with FTD and their families to connect with others who are going through similar experiences. These groups can provide a safe space for sharing experiences, discussing challenges, and receiving advice and support from others who truly understand what they are going through. In addition to social and emotional support, there are also professional services available to those with FTD and their families. For example, occupational therapists, speech-language pathologists, and physical therapists can help individuals with FTD maintain their independence and quality of life. These professionals can provide guidance on how to adapt to changes in cognitive and physical abilities and recommend modifications to the home environment that can help with mobility and safety. Lastly, it is important to seek medical care from a doctor who is knowledgeable in FTD. This includes seeing a neurologist, geriatric psychiatrist, or cognitive behavioral specialist who can provide a diagnosis, monitor the progression of the disease, and recommend treatment options. With the right support, individuals with FTD and their families can navigate the challenges of the disease and find ways to maintain their quality of life. 8. Coping strategies for those with frontotemporal dementia. Coping with frontotemporal dementia (FTD) can be challenging for both the individual affected and their loved ones. However, there are several strategies that can help make this journey more manageable. Firstly, it is important to establish a daily routine that is predictable and easy to follow. This routine should include activities that the individual enjoys and finds fulfilling, as well as those that promote physical and mental well-being. Secondly, communication can be a major challenge for those with FTD, and it is important to find ways to effectively communicate with the individual. This may involve using simple language, speaking slowly, and using visual aids such as pictures or diagrams. Thirdly, it is important to provide a safe and supportive environment for the individual. This may involve making modifications to the home such as installing handrails or removing tripping hazards, as well as providing supervision and assistance as needed. Fourthly, it is important to take care of yourself as a caregiver. This involves seeking support from friends, family, and healthcare professionals, as well as taking time for self-care activities such as exercise, hobbies, and meditation. Lastly, it is important to stay informed about the latest research and treatment options for FTD. This can help you to make informed decisions about the care and treatment of the individual, and can give you hope for the future. With these coping strategies in place, individuals with FTD and their loved ones can navigate this challenging condition with greater ease and resilience. 9. Research on frontotemporal dementia. Research on frontotemporal dementia (FTD) is ongoing and is essential to understanding the causes, symptoms, and potential treatments for this condition. Many researchers believe that there is a genetic component to FTD, and studies have identified specific genes that may be involved in the development of the disease. Other research has focused on changes in the brain that occur in people with FTD, including the buildup of abnormal proteins in brain cells. This research has helped to identify potential targets for new treatments. One promising area of research involves the use of stem cells to repair or replace damaged brain cells in people with FTD. Another potential treatment involves drugs that target specific proteins associated with the disease. While there is still much to learn about FTD, ongoing research is providing hope for improved treatments and ultimately, a cure for this devastating condition. It's important to support and participate in research efforts to help advance our understanding of FTD and improve outcomes for those affected by the disease. 10. Conclusion and advocacy for frontotemporal dementia. In conclusion, frontotemporal dementia is a complex disease that affects a person's personality, behavior, and language. It is important to understand the causes, symptoms, and treatment options available to help those who are affected. Early diagnosis is crucial to ensure the best quality of life for the person living with frontotemporal dementia and their loved ones. It is also important to advocate for more research and support for those affected by frontotemporal dementia. This includes raising awareness, sharing information, and supporting organizations that are dedicated to finding a cure. By working together, we can make a difference in the lives of those affected by frontotemporal dementia and bring hope to those who are struggling with this disease. Let us continue to support and care for those living with frontotemporal dementia and their families. We hope that our article about frontotemporal dementia has been informative and helpful to you. This type of dementia is not as well known as others, but it can still have a significant impact on the lives of those affected by it. We have covered the causes, symptoms, and treatment options available, which can help you understand the disease better. If you or someone you know is experiencing any of these symptoms, it's essential to seek medical attention immediately. We hope that you found this article useful and that it has increased your awareness of this debilitating disease.